I'm Michael Akande, a second-year medical student at IUHS, the International University of Health Sciences, and I'm here with one of the school alumni, Dr. Anu. Can you please introduce yourself?
Hello, my name is Rita Anu. I am a graduate from IUHS School of Medicine and recently about to start residency in July.
Great. So, Dr. Anu,
Mhm.
going straight to the first question. So, what initially made you choose medicine, and at what point did you know you were committed to the field?
Yes, I was inspired by my mom, who is a retired nurse. She worked in a very rural area in Cameroon where there was no doctor, and she did so many things from consultations to delivering babies and also taking care of some traumas all by herself. I remember every now and then accompanying her to the hospital when
Mhm.
people would come to our house like 2 a.m. Because someone was in labor or someone was really sick. So I felt the need to be part of healthcare to contribute.
Beautiful, beautiful. Thank you, Dr.
Mhm.
Arnold. So it's a thing to know you're interested in medicine. It's another thing to decide on where to go, to study medicine. So why did you choose
Mhm.
IUHS, which offers a hybrid, non-traditional education instead of a traditional in-person medical school?
IUHS is very unique. Um, I have been wanting to go back to school since I had been a PA for a while, and I was just thinking about the demands of a medical school, and it was a little difficult to imagine myself going in, sitting in class. When I found out about IUHS with the hybrid program,
Yep.
the life lessons, it was a perfect opportunity for me. So I think IUHS offers a great opportunity for people who still work and go to school. You can come home and log in and join a class and don't have to be in person in a classroom.
Oh, yep. Thank you. So now, as a
Mhm.
doctor, as a medical doctor, looking back at that decision, do you think or do you believe IUH's non-traditional model gave you a unique advantage over not traditional educational models?
Oh, absolutely. I don't think I would have done it without um, IUHS because I work, I have a family,
Yeah.
and I have to work and go to school. And the fact that you're able to pace your studying is also really great. I took some time off from work um, to study, to take exams, and then sometimes build in that PTO to use again. So the fact that I was able to pace it and finish in 5.5 years instead of 4.5 years, 4 years, it made it possible for me. So that is a very important aspect of my learning that helped me accomplish this goal.
Oh, beautiful. So for everything unique and different, there are always
Mhm.
stereotypes, especially when people are not used to such particular model. So actually, if I'm gonna ask you, what misconceptions do you think people usually have
Mhm.
about non-traditional schools like IUHS, and how would you respond to them today? Do you want me to go over it again?
Yeah. I think the most common
Okay.
misconception is that there's not a lot of hands-on. Yeah, say that again.
Okay, thank you.
Yeah, the most common
Yeah.
misconception is that there's not a lot of hands-on with
Mm.
this the non-traditional model. But with IUHS, we had to actually do 20 hours of 20 clinical hours during our didactic year, and also our rotations are pretty much similar than the traditional medical school, like this traditional medical schools. We have to do all the core and elective rotations, and we go through residency.
Oh, beautiful. So,
Mhm.
what aspects of medical school actually challenged you the most? Is it the academic side or the mental side of it?
I would say the academic aspect of it because it was really demanding the time that I had to put into study, to be in class, um, and also to um, do my rotations. It was a lot. So it took me a while to it took me a lot of time. Give me one
Mhm.
second.
Okay. So now talking about, academic challenges during medical school, what study methods worked for you the most effectively during your preclinical years at IUHS?
Yeah, I think just after lectures, just going back and studying immediately was great. And also getting my home assignments done in a timely manner and not keeping things till the last minute. That was very helpful.
Great. So, what tools or support does IUHS provide to help you maintain motivation and consistency while studying remotely and independently during your preclinical years?
So yeah, IUHS has great resources. There is Lecturio. Lecturio offers so many lectures, and you can go back and watch them. They also have a question bank that you can use to study and prepare for your exams as well. And also there is a Access Medicine. Access Medicine has a
Mhm.
huge variety of learning resources from flashcards, videos, simulations that you can actually pick the areas where you're not very strong in and watch them or do the flashcards. So there's a lot of resources
Oh,
to
thank you. Very
help.
cool. So, as a med
Mhm.
student myself, I can tell you that I've had my fair share of imposter syndrome. So, during your time at IHS, did you ever experience burnout or, imposter syndrome at any point? And how,
Burnout, I would say
and how did
yes.
you handle it?
Yes. Just staying like positive and just looking forward, staying strong and, hoping that, everything comes through smoothly. It wasn't easy, especially when I had to finish my shift and then continue with clinicals. Um, for imposter syndrome, I would say no, because I have always believed in myself. I know that when I put in the work, I will do well. And even my family believes in me too. So each time I tell them that, oh, it was a difficult exam, or was it, they say, oh, you'll be all right. We know you can handle it. So yeah, it was the physical aspect of it was more just the time and yeah.
Oh, beautiful, because
Mm-hmm.
IUHS is an online is a hybrid medical school, that offers the preclinical part of the program online. So
Mm-hmm.
considering that, you know, during your preclinical years, what skills do you think were the most important to succeed?
Skills that are most important, I would say, the ability to multitask, especially if you have other commitments, and plan ahead of time, know what it entails, to
Mhm.
accomplish what's ahead of you, and starting to work towards that as early as possible.
Oh, okay. Thank you. I think we've talked a lot about, the preclinical years and all of that. But
Hmm.
what was something you found useful from your preclinical years that benefited you the most at clinical rotations?
So could you repeat the question again? It
Okay,
was a little
what
break
was
up.
something you found useful from your preclinical years that benefited you the most at clinical rotations?
Hmm. Um, I would say the, just the background knowledge, just being able to learn more. As a PA, I did study medicine to an extent, and I feel like my preclinical year gave me a deeper understanding of what I was doing, which actually helped me a lot in my clinical year. I've had a lot of patient contact experience as a PA, so that wasn't a new thing for me. But just getting that additional knowledge was quite helpful.
Oh, great, great. So, rounding things up, were there any moments where the flexibility of IUHS's MD program became a major advantage for you?
Yes, definitely. The fact that I was able to pace it, like I mentioned earlier, it took me 5.5 years. And because I have a family to support, I had to work. And I don't think I would have been able to do this within 4 years. So
Beautiful.
that flexibility is great. And also, the fact that I didn't have to leave my family
Yeah.
for in-person classes. Yeah,
Yeah.
that was also very helpful.
Oh, great. So, as a student
Mhm.
myself, I would like to ask you if you have 20 seconds to advise me
Mhm.
as someone who has walked through this path,
Mhm.
what would you say?
So I would say, yeah, I would say make sure you get the information that you need
Mm.
to go through the program and plan ahead of time and start early. If you have to take the step exams, start on the one like you're preparing for the step exams and be consistent and stay disciplined with studying. That counts a lot. Gather your resources early enough and make a study plan.
Oh, all right. So, Dr. Anu, thank you very much. I appreciate you, coming on here and sharing your experience as an alumnus to the great
Mhm.
school IUHS. Thank you so much. Hopefully, I see you again
It's
very soon.
Thank you. It's my pleasure.
All right.